Hello, I'm Dr. Haydee Brown,
I'm Dr. Sonya Sloan,
and we are AYA.
Black and Brown Women Disruptors in Healthcare and Beyond.
Today we have a special guest, Dr. Bande Virgil, who is a board certified pediatrician and assistant professor of clinical pediatrics at the Mercer School of Medicine Columbus campus. She's a part-time pediatric hospitalist with Piedmont Columbus Regional Hospital and also works in private practice at Pediatric Partners of Columbus. Dr. Virgil has more than a decade of experience caring for full-term newborns, sick teenagers, and children in the hospital after delivery. She also sees children of all ages in her office. She is an expert in health education for members of community organizations and business entities on a wide range of health topics impacting the lives of children, teenagers, and their families. Dr. Virgil is a writer with several national publications addressing work-life balance in the lives of physicians, healthy living for families and children, mental health and well-being, with features in The Bump, Clinician Today, Kevin MD, and blackdoctor.org. She is the original author of the best-selling book, The Chronicles of Women in White Coats, and the upcoming book, A Teaspoon of Honey, Parenting in the Millennium. Dr. Virgil is the owner and host of the podcast, The Children's Wellness Spot, available on all platforms, where she talks about all things related to the emotional and physical wellness of babies through their teen years and healthy families in a relaxed, conversational format. Welcome to AYA, Dr. Bande Virgil. We are so happy to have you join us today.
Thank you for having me. Thank you for having me.
And since we have you here, and we usually try to hit on these hot topics, as you know, according to the Associated Press, recently the confirmation of Robert F. Kennedy Jr. He made some promises to U.S. senators when he was being confirmed. He said he would not change the nation's current vaccine schedule. But on Tuesday, speaking for the first time to thousands of people at the U.S. Health and Human Services Agency employees, the ones that hadn't been fired yet, he vowed to investigate. I don't know what that looks like, what that means, but he said he was going to investigate childhood vaccine schedules that prevents measles, which we know there's an outbreak right now, polio, and other dangerous diseases. So, Dr. Virgil, my first question is, RFK Jr. has been a critical voice against vaccines and their safety. So, from your expertise, your pediatric expertise, what do you feel his hesitancy is about vaccines?
Thank you for the question, and thanks again for having me, ladies. This is such a timely topic, and if you recall or you are aware, there were actually several letters written by several members of the American Academy of Pediatrics and Pediatricians across the nation during his confirmation process because we were so concerned about this very issue. And to answer your question, the hesitancy to me comes from a valid place. I have patients constantly who have questions about vaccines and adverse effects. So the process of questioning and kind of having some curiosity about vaccines and side effects is a valid exercise. However, the hesitancy when it's based and rooted without evidence is the challenge. And so, we've had conspiracy theories abound of late. And so he is the author in a lot of ways of some of these conspiracy theories. And in the world of pediatrics, vaccine hesitancy is not actually new to us. We've been dealing with it for about a decade and a half, to be honest with you. And he is one of the largest proponents of it. So, yeah, it's a tough time.
So how do you counter the his concerns, and when you're talking to parents, how do you deal with that? How do you navigate that conversation?
That's an excellent question. So we've walked a journey as a collective in the American Board of Pediatrics. So initially, when this really started to take hold in the early 2000s, 2010, the philosophy was kind of, encourage families to get the information from valid sources like ourselves, but then also there was a little bit of leniency encouraged. You all may be familiar with Dr. Sears, that this was a popular alternative schedule that was really prevalent on the West Coast. And so for a long time, the AAP didn't really speak out against that, if you will. And so we sort of allowed parents to make those decisions in partnership with us, and we call that, informed decision making together. And what has happened and how that has evolved, I think it created a space for just a lot more misinformation, to be honest with you. And so the AAP kind of switched and pivoted. So the recommendations now are really just to encourage, 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 encourage. And so it's about building relationships, building the rapport, letting parents know that you are making shared decision making with them, and that you are part of this journey with them.
Yeah, it is a journey. You're right.
Wow. Just one thing. What is the AAP?
The American Academy of Pediatrics.
Okay, great. So hot topic, going again on the news. As of February 19th of this year, 2025, several measles outbreaks have been reported in the United States, in Texas and New Mexico. In Gaines County, Texas, a significant outbreak has resulted in 58 confirmed cases, primarily among unvaccinated individuals aged 5 to 17. And the outbreak has spread to neighboring counties, including Terry, Yoakum, and Lynn. In eastern New Mexico, health officials have confirmed 8 measles cases linked to the Texas outbreak. They're also in other states, Alaska, Georgia, New York City, Rhode Island. As of February 6th, these jurisdictions have also reported measles cases. And health authorities emphasize the importance of vaccination, as measles is highly contagious and can lead to severe complications. Ensuring up-to-date immunizations is crucial to prevent further outbreaks. Dr. Virgil, what recent shifts in vaccine policies with the recent shifts in vaccine policies and regulations, what do you think are the biggest challenges pediatricians face in maintaining public trust in immunizations?
Whew, that's a tough one. It is monumentally challenging. I cannot underscore enough what we've already been through with the misinformation that predated COVID. So we've always operated in the space of vaccine hesitancy. There's always been a subgroup of patients and parents who just, for whatever reasons, whether it's religious reasons or just cultural reasons, have been hesitant. And now, like I said, this has exploded exponentially. So the challenge with these regulations is monumental. We may have changes in mandates and recommendations, which will then cause difficulty and challenges for pediatricians in obtaining the vaccine. So access may be limited for our patients. Reimbursements. I know that there's a lot of misinformation about pediatricians actually making money off of vaccines, which is not true. We do not make money off of vaccines, but they are a critical part of child well care. So when you're getting reimbursed with your insurance, that's part of the billing process, right? So it may not be covered, which then leaves the gap in how patients will actually receive the vaccines, and they'll be able to pay for them, or how these practices will be able to purchase vaccines. So mandates and recommendations have a major impact in healthcare outcomes because it can transform access for children significantly.
So, Dr. Virgil, I want to take a step back on the step back one in AYA. What is measles, and how does this manifest when you're seeing kids with measles in the ER or in the hospital?
Yeah. And it's so interesting that we're talking about how does measles manifest. I remember being in training years ago, and we were talking about these diseases as something from the past, literally something from the past. And so cough, coryza, a very distinct sort of lacy rash that comes from your forehead down your trunk, high fever. These were things that we read about that never happened. But because of the changes in policy and because of changes now, which are at the federal level. And because of cultural changes, we're starting to see these things more. So these are vaccine preventable illnesses, measles being one of them, that used to cause a really high level of infant mortality. And it's not necessarily from the measles themselves, it's the viral processes that are unloaded from the inflammatory process. So measles related hepatitis, lots of whole body systemic issues. So mental health issues, dementia, seizures, respiratory illnesses, pneumonias related to it. And so measles is not something benign, which we mean nothing small. It's a big deal. And so if we can prevent death, which we can with the vaccines, and morbidity, which is illnesses that are downstream from the infection, then that's a tremendous benefit for our children.
So it's interesting that you note back in med school, I recall, and Dr. Sloan, you too, learning about measles, and it was something of the past, right? You had to look at pictures of kids with measles, and yeah, we needed to memorize the symptoms, but it wasn't something that you would expect to encounter when you're seeing pediatric patients. So it is a bit jarring for you as a pediatrician to now be very familiar with measles, and for us to really even have measles in the discussions around the United States. And these outbreaks are concerning, right? They're concerning, scary, and so contagious it can really impact larger populations. Do you think that with this large discussion about vaccines and the discussion about mandates, and now this discussion about vaccine hesitancy, do you think that and having the head of the HHS be a huge vaccine conspiracy theorist, do you think that the mandates that exist help or hurt vaccine acceptance?
I think the mandates help shore up vaccine acceptance. Our population is interesting. So we have a huge subset of the population that, if it is recommended by the government, if you will, or by entities that are, with the government, people accept it and they feel like there's validity behind that mandate. But then there is another subset of the population that is suspicious of all things that come from the federal government. And we're just in that climate. And again, I hearken back to COVID-19. I think that was a pivotal time for us in healthcare. We've talked about that, but it really impacted the acceptance of the role of the federal government. So my answer to your question is it's probably about 50-50. And so for those who look to the government and look to experts for guidance and for information, it's been difficult because now there's a void in that space, right? But for those who have not trusted the government, they're just emboldened. I knew I was right. I knew all along that there was something wrong with these vaccines, is what families like that are saying. So it's a challenging time, and I think there's some nuance to it.
Well, I think you hit it right in the nail on the head. I mean, with all the misinformation, with the division of the country right now politically, and specifically on this topic of immunizations, vaccines, and now we have a spread of things that had been under control, if you will, and from polio and TB and measles. But what's the most effective way for pediatricians, as well as public health officials and other doctors, to combat the myths and provide evidence-based guidance for the families? Like, what is the best way for us to disperse that information, if you will?
I think the best way, and we've always utilized this methodology, is trusted messengers. And so I think each of us, if we take ownership of the story of the vaccines. So all of us went to medical school, right? Obviously I spent a lot more time with pediatric patients, but all of us understand evidence. And so these are not necessarily complicated issues, but I think if you break it down to the relational conversation, then, and you're a trusted messenger, when you are now sort of amplifying the importance of vaccines, there is some weight to that. So there's a role for us as pediatricians, but there's actually a role for the entire community in this conversation. So I'm thinking about school teachers, I'm thinking about pastors, I'm thinking about anyone in the community, a coach, something as simple as a coach, because what I've found is that people tend to get their information from trusted messengers. So if I encounter a family member who has had an adverse experience with a vaccine, I start to ask questions and they draw gross generalizations about that experience. That's going to now influence how I feel about those vaccines. Or if they have gone on TikTok and seen a video that suggests that this vaccine cannot be trusted, then I am going to start questioning, is that really the vaccine for my child? I've had so many patients who actually have gone through the 2 and 4 month vaccine series, and then all of a sudden the parent comes in at a year and they're like, yeah, we're not doing anymore, we're done. Well, what happened? They had a conversation with a family member who found something in some subset of the internet and kind of went with it because that was a trusted messenger for them.
The
So we
subset of
have
the internet. Yeah, you're right.
So we have to counter those messages, all of us collectively who believe in vaccines and their validity.
That's good.
Wow. Wow. I'm still in a little state of disbelief that we have to talk so much about this. And I do like that you highlighted how the COVID-19 pandemic really kind of brought this again into the forefront, particularly that discussion about vaccine mandates to be able to go to work, to be able to fly, to be able to travel. And that plus social media really has augmented the conspiracies and the alternative thoughts about vaccine safety.
Mm-hmm.
Do you think that there are long-term, implications for the current anti-vaccine position that our government has taken? And I do like that anecdote that you mentioned that some parents are allowing, the first couple of months of vaccines and then they're withdrawing that consent. What are potential problems with that and the impact of that on public health moving forward?
Ooh, that's a great question. The impact is monumental. I keep going back to that word because I think we've always dealt with this vaccine hesitancy, but I never thought that it would get to be elevated on this level of a platform. It's always been something, like I said, that existed sort of in a subgroup in our communities. But to realize now that this is literally coming from the government, it's very disturbing. Monumental impact in that obviously now we'll have vulnerable populations. I think that people don't understand that vaccines only work when there's an adoption in the population of the vaccines. That's what herd immunity is. If I vaccinate myself, but everyone around me is not vaccinated, the protections are decreased, right? And so it doesn't work if we're not going to all adopt the vaccines. And so our culture has shifted such that everyone is for self, right? So if we're concerned about big government and its role in our individual lives, it's almost counter to the mission of public health, because public health is by definition for the community. And so we really are in a difficult place. So we have the potential, the very likely potential of seeing the resurgence of these illnesses that we have almost eradicated. I remember the World Health Organization declaring, in the early 90s that smallpox had been eradicated.
Right.
And so that is the problem with the success of the vaccine movement, is that most of us have never seen these illnesses. Those of us who practice pediatrics in tertiary hospitals, which is like very specialized hospitals, will see things like epiglottitis, which is bacterial infection of the throat, or these other things that vaccines have essentially cured. But most people don't see that. What people see are their family members who have autism, and they don't know why they have autism. They see, kids who have other disabilities, and somehow that has been connected incorrectly to vaccine administration. So the outcome is monumental. The impact is monumental. I can't understate it. And I think that people get tired of us raising alarm in this era, in this time, but this is pretty serious. If you go through history, the average family in the 1900s was like 10 children. And almost half of those children died because of infant mortality
Ooh.
related to these
Wow.
vaccine preventable diseases.
Wow.
Can you
Infant
repeat
mortality.
that one more time? Because I think that's really,
Yeah.
Huge.
that's
Yeah.
huge.
So if you think about this country in the 1900s, so many families were, size 10 family members. They'd had 10 children. Of course, people were in the agricultural setting, so had to work on farms and things like that. But part of it was because of the high rates of infant mortality, which is death in a child under a year.
Wow.
So, and because there weren't the vaccines that we have, like, a lot of these vaccines are the 1930s, 1950s, 1970s, the 80s. So we're talking about the 20th century was transformational for infant mortality. Most people know now a child who has a chronic disease that is living with chronic disease. That's one of our FK Jr.'s topics of choice, which is an important one. Don't get me wrong. But if you can't live past a year, you don't even get to live to have a chronic disease.
Right.
Make no mistake about it. That's the challenge, is we have to contextualize the emergency. And so we have successfully vaccinated the population so we don't see these diseases. And now we're in a frontier where we have to address chronic disease because of the luxury provided to us by vaccines.
Wow. That's deep. That's huge. The fact that we have to now shift our thinking on a dime because of this confirmation of this one person who was not qualified for this position, as well as others that are at the helm right now. But in light of all of that, we still want to be very informative and educational. So what is the advice or the resources you can recommend to parents that are freaking out right now, who may be hesitant, or even if not they're hesitant, they just want to be educated and have questions? Where can they get information about that when they're making decisions about their children?
Accurate information.
Accurate, yeah.
Information.
My favorite websites are from the American Academy of Pediatrics. I can't state that enough, just because that is the society where most pediatricians are certified and board certified. So that they have undergone a certain level of rigor in their training. They have a certain capacity of knowledge. And so the AAP has a wonderful resource called healthychildren.org. And unlike the CDC website, which now is under transition, and I'll say that, under transition, which was also a very reliable resource for vaccine information. And in fact, most offices would hand patient families teaching sheets
That's
from
right.
the CDC.
I've gotten several.
Yeah. So healthychildren.org is a wonderful website.
So wait. So you're saying they're not handing those? When I would go in to get my kids the shots, which we recently had a set of shots for tetanus and that kind of stuff, we got the CDC sheet. They're not handing those out now?
No, we still have them, but there's going to be access changes with that. Like, just even thinking about the treatment for certain diseases, that information is being changed or taken down from the CDC website. So just managing like STDs and things like that, and all of that is changing. So to be continued. As of right now, I think most offices still have access to it. We had our teaching sheets in files, and what's great about most of these vaccines is they're pretty well studied and have not changed in several years. So if you break them down by vaccine, DTaP, diphtheria, tetanus, and pertussis, that is an old vaccine. I mean, like 20 years old. So the information has been pretty static, unchanging. So we have that in our office files for parents to access still. The issue will be as updates come, new vaccines come, hopefully, that information will still be there.
Wow.
That just,
it's heavy.
That conversation has really almost taken my breath away. Indeed. I mean, really thinking about how a change at the top can
trickle down.
And
find out phase.
We're in the find out phase. And the painful thing about this find out phase is that it's going to cost lives. It's going to cost, it will, if it doesn't take a life, it will greatly limit people's ability, right, with a chronic illness or what have you. And that's mostly preventable.
Yeah. That's the thing that's very heartbreaking for me. It's multiple issues. the pediatric patients don't have agency. They don't have the ability to speak for themselves. So
Right.
we're all proxies for the children in our community. And for me, I'm a proxy for my patients who are children that can't go vote, they can't go advocate, they can't lobby, they can't speak about their experiences. They are entrusting all of us. And I try to approach the vaccine conversation from a mutual respect perspective, because I do think that most parents want to do the right thing for their children. So I don't want to disparage them for their thought process. What we're dealing with is what is the evidence, and how do I analyze evidence, and how does someone who does not have the expertise analyze evidence, and how do we meet in the middle? But it is very concerning. It is very concerning, and we've had conversations in the pediatric world. What is our role? If I don't want to be political, what is my role? And do I have a choice to not be engaged in the political process? Because these mandates touch upon the everyday work that we do.
Right.
And our number one job as pediatricians is prevention. That's been our niche for the longest time. So our goal is to have these children develop into successful, healthy individuals who meet their goals. How do we do that? By ensuring they live through the first year, through the
Right.
fifth year, and then on forward. And so, again, this is not to negate the importance of talking about chronic disease. We must talk about that. That is the new frontier, and it's because of the success of where we've come with preventing things with our vaccines. And so kudos to the public health movement and family medicine docs and pediatricians for advocating all these years.
Yes. Kudos. Yeah. But you give a new perspective of the lineage of having vaccines, to have the luxury, as you said, to be able to have chronic disease to treat later on. But yeah, we're in a different frontier right now,
We are.
unfortunately.
Yeah. Well, this was a really fantastic.
Awesome. Very
Awesome.
educational, even for me. Yeah. I'm like,
Yeah.
we deal with bones, not babies. So.
Yeah, I know. We're like bone doctors. I mean, we have medical knowledge, of course, but not babies. And
but I love that you guys are using this platform to spread information and allow people to really process things from a perspective of being informed, so that they can make informed decision. That's a universal concept to all of us in every specialty of medicine. So that resonates with me. And I do hope that the audience understands that this is a time where they have to think critically and really have to think about where their information is coming from, and then return back to a trusted messenger about that information, because we can't just take everything at face value at this point, unfortunately.
That's good. Well, thank you for being our trusted messenger tonight.
Anytime.
how do our viewers find you, Dr. Virgil?
I am on Instagram, like many people. So my job is to try to break through the noise, the cacophony, if you will, of misinformation. So you can find me on Instagram at the Mommy Doc 1. And also I have a podcast, The Children's Wellness Spot, where we do similar to this, just talk about things that impact families and children in a really relaxed setting. So we can break down some of those barriers.
Awesome.
Well,
yes.
This was such a wonderful discussion. Thank you for joining us. And then thank you to all of our viewers for watching. We are AYA, Black and Brown Women Disruptors, and our existence alone is revolutionary. So please subscribe, comment, like, and share, and we'll see you next time.
Have a good night.